Today we're exploring a specific kind of psychological wound, post-traumatic embitterment disorder, or PTED.
So what happens when a deep sense of injustice takes hold and just refuses to let go?
At its heart is this feeling, embitterment. It's a reaction to injustice, humiliation, and a breach of trust. And when that feeling becomes severe and just won't go away, it can actually become a clinical disorder.
Now, unlike PTSD, the trigger doesn't have to be life-threatening. The trauma is how it sickens your mind.
The triggers can be common life events, things like conflict at work, a divorce, or a deep betrayal.
But here's the thing, it's not the event itself, but how you personally experience it as a violation. So let's be clear, PTED is about injustice and anger. PTSD is rooted in life threat and fear. Okay, so what are the symptoms? Well, they're persistent and they can really disrupt your daily life.
And it's different from depression. A person with PTSD might even smile when they think about getting revenge.
In fact, recent AI studies have pinpointed sullenness as a really central symptom of PTED.
And this isn't short-lived. One study found the average duration of the illness was about 32 months.
And some life experiences can unfortunately increase the risk, like a history of trauma or health problems.
This makes treatment really tough because patients often feel the world needs to change, not them.
So therapy often starts by looking at what's called the double punishment of the whole situation.
See? First there was the event. The second punishment is the ongoing suffering from your own reaction.
A treatment called wisdom therapy actually helps build skills to find a new perspective on what happened.
The whole goal is to reframe the past so you can reorient yourself toward the future.
A huge turning point is realizing the problem isn't the past, but the crippling emotion you feel now. Which leaves us with a critical question. If you can't change the past, how do you change its power over you?